Sciatica is one of the most common back problems that we see and treat, and it is very much so something we can treat well if we catch it early. So what sciatica is a pinched nerve, and it can create a lot of problems with back and leg pain. And if we catch that within the first couple months, we can treat it conservatively with typically rest and anti-inflammatories and physical therapy. But if those conservative options don't work, then we can treat it with things such as injections. But very rarely does that require an aggressive treatment with surgery if we catch those symptoms early. Spinal stenosis is another common painful condition that can cause back and leg pain. And typically it is, we see it more associated as we get a little bit older, and it creates a lot of problems when we're trying to do things around the house and in the yard, and just creates some difficulties for us. And it's something that we can typically manage and not treat surgically. Again, physical therapy and medications and injections can be a large component towards helping that. In some cases, when the pain gets severe and there's other types of problems developing related to the nerves, we may need surgical treatment, which we can speak to our colleagues about that.